There we go. Alrighty, so just making sure that I'm doing everything. Okay, good. So welcome everybody. Welcome to the Allume Town Hall for June 9th, 2020. Can't believe it's already June. I'm very grateful for the opportunity to be with you all today. It's been an incredible 12, 14 weeks, whatever it's been now, since we've been operating in this new way. And I'm just gonna put everybody on mute. If you wouldn't mind putting yourself on mute, because there's a lot of background noise. I'm just gonna ask you all to mute. Okay, great. And if you wanna unmute, you can. I just muted everybody. So as we continue on, I just wanna thank you for being here and talk to you about what's happening at Allume and beyond. So what are the current stats of COVID? What's happening with that in our community? What is happening on the near horizon for us in terms of the business? I want to give you an update on PPE. We always want to remind you of the simple things that we do to keep everybody safe. And then we want to talk about actually two important things that we're going to talk about today is the 3-second improvement launch and a team survey. And I'll explain more about that when we get there. All right, so again, during this time of COVID-19, our intentions are to make sure we keep everybody safe. And we want to do whatever we can to rise to the occasion, especially at times like now, where we start to feel like this is old hat and we're starting to get used to things and the state is starting to open up. And, you know, our kids are going to want to go and have play dates and you know, we're going to want to have fun over the summer and get out, which is all wonderful and good. It's important that we continue to remember our role in the community and that we are responsible for people beyond ourselves and our immediate families. We are responsible for people who are medically fragile. So we have to live at a higher standard through this process. So remember that our patients' biggest risk is those coming in from the outside, bringing germs in from outside. So we want to make sure that we do everything we can to eliminate that risk. We do not want to be the ones that bring in an infection, namely COVID-19, coronavirus, and we want to make sure that we're helping families eliminate any kind of transmission of the disease in their homes as well. So keep in mind that important role that you continue to have. Our biggest defense is PPE. We've seen that as being the thing, the most important factor, along with cleaning and disinfecting and doing everything you can to personally diminish your exposure. So where are we in the state of Connecticut as of 5:30? So, you know, last week we were at 42,000 cases of COVID in the state of Connecticut. And there have been 3,900 deaths. You can see the majority of those cases and deaths have been in Fairfield, Hartford County, and down in New Haven. So those are where the most populated areas are. But they're, you know, certainly it's across the entire state. There's no place that does not have exposure. And while the curve has certainly slowed and is going down, we need to remain vigilant. Remember the symptoms of COVID-19, cough, shortness of breath, people with fever, chills, shaking with chills, muscle pain, headache, sore throat, taste or smell loss. So you want to watch out for those things for yourself, and you know, really keeping an eye on your fever, your temperature is a great way to sort of every day check in with yourself. And I know you're all, you know, most of you are putting in the form, the electronic form to do the temperature screening every day and answer all the questions to make sure you're free of any kinds of questionable symptoms. reviews those daily. That will continue. Very, very important to continue to do that. Here are the questions again. Want to make sure you call prior to your shift and ask these questions of your family members, the family members and patients. And then when you get there to the home, you want to continue to ask these questions. And I know it probably feels odd and strange, but it's important to keep asking them. And then if they answer yes, that they have any of the symptoms, you want to make sure they put a mask on, you put a mask on, you call the office and ask to speak to the administrator or supervisor so that you can navigate what to do next. So right now the office is open Monday through Friday with a fulfillment team member at least present to answer phones, collect packages, and also to distribute PPE. So the office is back open. There's some businesses that are already opened and will continue to opening with modified rules of operation and PPE types of requirements, etc. Childcare camps, summer school are opening in June and July. I heard the pools are going to start opening on June 20th. There will be some more activity going on in the world. We will continue as a company to operate in a quasi-virtual fashion. We want to keep density down in the office. We want to make sure that we don't have people who do the same job interacting with each other so that we have backups. We want to keep our clinical team separate from each other so that if one person contracts the disease, that not everybody on the team contracts the disease, and then the whole team doesn't have, isn't able to go and take care of the patients. So we want to make sure that we continue on that. We want to make sure that PPE continues to be of the highest importance when you're out in the field. So we've talked about this before, that for the way that CDC looks at this is that for everyday routine care for a non-COVID patient, then you would have one mask minimum per week, but potentially daily based on visit volume. That for routine of pediatric and leukemic patients, it's also the same thing. Care of patients with suspected or confirmed COVID-19, you want to continue to use your surgical masks and make sure that you only use that mask with that patient. And if you have a K95 mask, which you all do, at least you should, then you want to use that. You want to have eye protection. You want to have a gown and gloves. And then if you're doing any kind of aerosolizing, producing procedures with a COVID-19 patient, you want to make sure that you are using an N95 and eye protection gown and gloves. It's always required for aerosol producing. So the difference there is the respirator mask is required versus a surgical mask. So this is what the CDC has recommended. We want to make sure that our patients are really, really safe. So we really would like for you to be extra vigilant. So we want to make sure that at all times there's an emergency starter kit of everything that could be needed in the home. So please let us know if there is not a starter kit, and this is a kit that should not be used unless your patient becomes COVID-19 positive. So basic masks, 3 N95 masks, 4 yellow gowns, 1 eye shield, and gloves, right? So make sure that when you are your next shift, every shift, make sure there's an emergency starter kit. If somebody becomes active with COVID-19, then we would then begin to distribute a weekly PPE kit for all of our patients. Currently, no patients have COVID. So everybody should be using their personal PPE kits that you collect from the office. So ideally you want to go to the office and pick up what you need for supply, 1 to 2 weeks supply, more if we have adequate supply. And what you'll be given will be based on the amount of shifts you work in a given time period. So you'll get 1 box of masks, 1 surgical mask, excuse me, per nurse for 5 shifts, 1 box of gloves for 5 shifts, and 1 to 2 reusable gowns, cotton masks to be disinfected, 1 N95 to be disinfected and reused, 1 eye protection set, whether it's a goggles or a shield. One gown to be provided per patient you serve, and that's for shift nurses and home health aides, and also plastic aprons. So you should be coming into the office to get those. We know that this is terribly inconvenient, and we are working to produce a new program where we can start to bring PPE back out to you, but we're still in transition with that right now. So again, you want to make sure that you have a mask on at every shift. You should be using a surgical mask, and if you don't have one, then you should use one of your cotton reusable masks. And so if you're going from house to house, if you're doing intermittent visits, you need to make sure you don't use the same mask when you go in and out of each house. For gloves, again, you want to make sure you're wearing gloves at every single shift, anytime you're interacting with a patient. Eye protection you want to be wearing right now. Gowns, you want to make sure you have a gown available, especially for any aerosol producing procedures. You want to have those along with the plastic disposable aprons. It'll keep your gown clean and safe for your use. You want to use your hand sanitizer. You want to make sure there's hand sanitizer in the home, and you want to make sure there's antimicrobial soap. So let us know what you don't have, and make a trip into the office, or coordinate with somebody from the house, from the team. Maybe somebody lives closer to the office and can go into the office and pick up supplies for everybody in the house. You can coordinate that. And then, you know, maybe you do it one time, and then your friend, your coworker does it the next time. So until we are able to get more supply, the issue is we can't get enough supply to give you a full month's worth of supply in the home. That's been our issue. We're getting close to that point now, but with the continued different kinds of businesses opening up, they're needing more and more PPE as well. So it continues to be a bit of a fight to get the PPE we need. And if we had to go out to every house, all 150 houses every week, and distribute PPE, we'd have to hire a whole bunch of extra people to do that. And so we're asking you to please work together with us and work together with your team to come into the office to get what you need. We want to make sure everybody has what they need, and if you have issues, please, you know, reach out to your ambassador and let's figure out how to get you what you need. So we're asking you to take a PPE survey. I'll distribute that after the call, but it's basically asking you about your use of PPE and making sure you have what you need. Again, we talked about this on the last call, the importance of cleaning your goggle and face shield every time you use it, the importance of how to clean your gowns, so how to remove the gown, untie it from your neck, how to take it off. If you're going to perform an aerosol treatment, to wear the plastic apron over the gown. For the non-disposable isolation gowns, which everyone should have, if it does become torn or soiled in any way that can't be repaired, then we should definitely replace those. If you're given a cloth isolation gown, it's your responsibility to take the gown home and wash it, or the tie back to take home and wash it before using it again. And make sure you wash your hands with soap or hand sanitizer before and after taking them on and off, so that you do not inadvertently spread it. You want to be wearing your surgical masks. Make sure you have enough masks. Ideally, you're reusing the masks for 5 visits or 5 shifts for 1 patient. If you're doing multiple patients, then you need to have a separate mask. You want to make sure you're washing your hands with soap and water before putting on the mask, right? And when ready to take off the mask, again, 1 ear pace at a time, spray the solution of water and antibacterial solution, place in a plastic or paper bag, and leave at the patient's home. The clinician should have a mask at each home, and if the mask becomes soiled, we want to throw it away and get a new one. So if you're going to use the cloth masks, which is good, then you need to keep those clean. Make sure you wash those between uses. Make sure you wash them only with the clothing that you've worn that day. Don't wash them with the rest of your laundry. Your N95 masks to be worn only if the patient is positive for COVID-19 and can be worn throughout the entire shift, but certainly during aerosol producing procedures. Remove the mask by taking off 1 ear at a time. Do not touch the front of the mask. Spray the solution, the antimicrobial, antibacterial solution, and wash your hands after removal of the mask and put away in a plastic bag. So these are things that we're just reminding you of. It's very important to stay very on top of the PPE. If you have a patient with COVID-19, which is again not yet, if the patient that is being cared and hopefully, you know, hopefully we don't spread it to any of our patients. We may at some point decide to take some patients who are COVID-19 positive. So if the patient does have COVID-19, the clinician should don and doff PPE outside of the patient home. So you put it on before you go in and you take it off after you leave the house. So you want to make sure you do that. PPE will be taken care of, you know, due to the short supplies, we want to make sure to use your PPE carefully and to reuse it whenever you can. Gloves should always be thrown out at the end of the shift. Unless they become soiled, they cannot obviously be reused. The PPE guidance from the CDC continues to, you know, impress upon us all to reduce, reuse, and repurpose. So those are the things that we want to, you know, continue to do with PPE. As you know, we sent out some information to our patients about elevated precautions, especially now that people are starting to go out into the world again and we're starting to feel a little looser about things. We want to just make sure everybody remembers that we have, you know, medically fragile people in the home. We want to make sure that we continue to stay vigilant, watch out for any issues you might be worried about if more visitors start coming to the home, if family members are not wearing their mask when they're close to you, for example, or in the same room as you. If you notice that the family might be traveling to places that might have lots of, you know, other, you know, more than their, you know, outside the 6 feet distance and have more than a few people present. If you have any concerns, please raise them up to the administrator, Marie, or supervisors, Kyle or Amy, so that we can help and to mitigate any kinds of risk. So we are continuing to partner with each family. We want to continue to see you educating them. A great way to educate them is to be a good model. Wear your PPE. Ask them to wear their PPE in your presence and in the presence of their loved one. Remind them of the questions. You know, by asking the questions, you're going to continue to prompt them and make them think about, how am I feeling today? Am I safe? Should I be doing things different? And you know, just staying, you know, vigilant in your own practice of how you interact with families. Hopefully you aren't going out into the public and doing a lot of, you know, too many things that are, you would be interacting with lots of people. Not a good idea to be talking about that, right? If you are doing it, then I hope you'll stop and I hope you'll wear your PPE, but certainly it's going to raise a lot of red flags and concerns for others if you start talking about a lot of social engagement that you're having. It needs to not be happening. So COVID-19 reminders, you want to do the staff screening form every single day. This is really important. I do it every day. Marie does it every day. Amy and Kyle and Christine and everybody does it every single day. And I don't even leave my house and I do it. Okay, so I'm not affecting anybody, but it's important that you take your temperature, you identify any of the possible symptoms that you might have, and that allows us to be aware and to escalate any issues. Wash your hands every 15 minutes, clean and disinfect, right? So clean and disinfect at least every 4 hours. Do the same at your home, especially high touch surfaces. Wear your PPE. have very limited physical contact with others, especially employees. We don't want to infect one another. Really important. Each of us needs to take precautions to limit our exposure. No traveling still, virtual meetings, refrain from crowds, no handshaking. Try to avoid lots of different people that you interact with. Try to keep it to a tight group. 6 foot social distancing always. If you're going to be with people outside. Clean and disinfect your own house. Follow the CDC guidelines. And notify the administrator of any exposure you might have. So if you have been exposed to someone, immediately let Marie know. When you are feeling under the weather, don't come to work, don't go into the community. Talk to Marie and we'll figure out the best approach to finding out if you are at risk. All right, and continue to do things that are good for you, right? This is a very stressful time for humans. It's a stressful time for each of us. Our kids are stressed, we're stressed, our family members, spouses, everybody has new kinds of stress. So make sure you're taking time to do good things for you. You know, I've had to really increase my level of self-care. I've, you know, had to really implement specific routines in the morning so I get my meditation in, I get plenty of rest at night, I make sure I have time to journal, I make sure that I have, you know, some downtime every evening where I can rest and relax. It's very important that each of us identify what those needs are. You might need to clean up the way you eat. You might want to make sure, I get up in the morning and I always do at least 30 minutes on the treadmill just to get my heart pumping and just to, you know, sort of get my head straight. All these types of things are self-care. I know a lot of people have increased their drinking, their alcohol consumption and other kinds of consumption. Watch for that. That's a signal that you're under stress and that you need to take care of yourself and probably deal with some pent-up frustrations, emotions, stress, and probably looking for, you know, pleasure and joy. And there are ways to do that without giving yourself different, you know, alcohol and drugs. So just be mindful of that. So I am excited to talk to you about a program we're launching called 3-Second Improvements. And so this is the first step in a series of steps to sort of encourage the whole team to be making continuous improvement out in the world. And so what is this 3-second improvement? It's an improvement you make, right? It's not something where you say, here's something that the company should do, but you're saying, I'm gonna make this improvement. So it's you are making that improvement, and it could be a big improvement. We talk about it being a 3-second improvement. It could be a big improvement, but it also can be a very small improvement. That's why we call it a 3-second improvement. And so it's a small, consistent, tiny improvement made daily by everyone at Allume. And it's improvements that provide value, quite simply. And value can be, you know, to anybody that's involved, to you personally, your teammates, the patient, the family, or someone else who's involved with your activities while you're employed by, you know, the time you're working with Allume. So if you're going into a shift, I'm talking about making a 3-second improvement that will improve going into that shift, or a 3-second improvement that will help if you are somebody who is in the finance department, will improve our finances in some way. Or if you're a clinical supervisor, that it will somehow improve overall clinical education, awareness, compliance, etc. So the ways that you might think about improvements could be, it might help us be more organized, might help you be more organized, might help the team be more organized, it might help someone else be more organized, a tool that you could build that would help somebody else. It might create effectiveness. So it might help us do something better, be more effective. So organization is, you know, sort of a structure to do something. Effectiveness says we're going to do something better. We're going to actually create, for example, we're going to go from having 60% of our notes on time to 95% of our notes on time. By the way, last week we're at 93%. So we made that improvement. So create effectiveness where we're improving what our results are. It could be a way that you could generate connection. At Allume, connection is important. Connection to your patients, connection to your teammates, connection to the families, connection to the community. So it could be an improvement that creates a more wholehearted connection or a more consistent connection, right? It could, improve the way that communication happens, improves outcomes, right? We think about that in terms of patient outcomes. So it could be something that could be a patient outcome, but it could also be any other outcome. It could be an outcome related to how we recruit. We're always trying to bring in more applicants. We're always trying to schedule more interviews, convert more of our offers into hired employees. So these are where we're, actually improving outcomes, ways that we can improve outcomes. We want to eliminate waste. So what I believe is probably very true is there's probably tons of waste that's sitting around in the way we do things. Things that either systems that are broken or are difficult to deal with, technology that's difficult. So we want to look towards how we can eliminate waste. And sometimes it's, we want to look for those 3-second improvements, little things we can do that eliminate waste. I was on a call this morning with the fulfillment team, and I watched Christine open her screen up and show all these different ways that a person who's in the fulfillment team could schedule themselves, schedule their patients faster. And so that's a way of eliminating waste, right? So instead of going in and adding each schedule individually, she showed how you could add it and add, a 3 months worth of the schedule just in one action. So look for where you can eliminate waste or where you see opportunities to eliminate waste. Anytime you can make something easier, anytime you can make something simpler, we want to do that. We want to do that personally. So those are the things, the types of improvement. So what needs improvement? So think about this, start to think in your mind how you have already made improvements in your job. And what are some things that you could do in the coming days, hours, minutes, seconds that could make some additional improvements. So the way if you're a nurse in the home, how you set up the home, right? Maybe you have a brilliant organizational structure for how you set up the house, and maybe you label things, or you really like this particular storage system that that you love because it has just the right shapes and sizes for all the supplies you need. So maybe your 3-second improvement one could be, like this is I have the master way to set this up, and here's how we do it. It could be organizing supplies. It could be creating a checklist of things you do when you arrive, things you do before you suction, things you do after you deliver meds. Like what are the things you do? And maybe you have a little checklist that you could put together to make sure that everybody does the job well. Maybe you have some ideas for how we could improve the accuracy of MARS and TARS. It's a big area of focus. Improve the accuracy of making sure we have updated orders and signed orders. Aspects of the curated care plan. So when you're thinking about a family and you're thinking about a patient, what are the ways you could improve their social, emotional, physical well-being, and what are things that you could do on again, it's about small, consistent, tiny improvements, consistent. So what are those little things you could do? Maybe part of their curated care plan could be updated. You want to look at how you can improve patient outcomes, improve infection control, especially right now, right? Maybe you have a great way for storing your PPE, or great way for managing and cleaning it. So reduction of PPE waste, maybe you have some ideas on that and that you've implemented or that you're going to implement. Maybe you have ideas on how you work together with your care team, or how you can improve communication where you see there's a breakdown in communication between you and somebody else on your team, and what could be something that you could start to do. Well, I'm going to email that person every week. I'm putting them on my calendar, and I'm going to reach out to them and just make sure I touch base with them every week. And just, I'm going to have my 3-second improvement is I'm putting it on my calendar, and I'm going to have an alarm, and I'm just going to make sure I do it once a week. So that's an idea. Making it easy to document correctly, right? Every month I feel like we have different areas of focus where our QA team is asking to make sure you document on certain items, like, you know, documenting that you're educating, right? And documenting that you're following the plan of care. Maybe you have some ideas for how to make documenting fast and easy, and that maybe you have a checklist that you have put together or would like to put together that we could distribute to the larger base. Maybe you have ideas on how we can reduce errors, med errors, errors in documentation, errors in orders, errors in plan of cares. Maybe you have a way to help us increase the number of shifts and visits we do every week. We're always trying to increase shifts and visits. Maybe you have an idea on how we can increase utilization. Maybe you have ideas to help us consistently hire 15 nurses a month. So how we can build more level 2 and level 3 nurses. These are things that need improvement. How we can better retain, satisfy, and engage team members. So these are all different areas. And this month, as we start this, we're just going to start with generic. Wherever you can find an improvement, we ask you to make that improvement and share it with us. So we're going to ask you to share your 3-second improvement with us daily. And every time you send us an improvement, we will include a $5 bonus to next month's payroll. So you can get up to $50 per person in the whole company just by, you know, putting in your daily 3-second improvements. And so how you do that is you'll have a 3-second improvement form. It's an online form that you can fill out, and you just simply share what it is. If it happens to come with a photograph, then you can email that photograph to admin and Allume Cares. So it'll become really simple and obvious. You'll get the text message, you'll click on the form, the link, and you'll go to the form, and you'll just share what is your 3-second improvement. You'll describe what it is. And then what we'll do is we'll calculate how many improvements you made. And at the end of the month, we'll include a $5 per improvement you suggest to us to your payroll next month, up to $50. And we'll also enter each improvement that you give to us, we'll enter your name for a drawing for $500. So if you put in 20 improvements, then we will put your name in 20 times, and then we'll do a drawing, and whoever gets pulled out of the hat will get $500. So we want to encourage you to see opportunities to make improvements, little things along the way. And you know, do your best to share with us whatever ideas you have. So those are the 3-second improvements, and I hope that you will get all into that, because that's super fun. The last thing I had to talk to you about actually came from a 3-second improvement. So we were meeting with the fulfillment team. I do that every morning, or 4 mornings a week or so. And when we were together, we started talking about 3-second improvements. And they've been trying to make 3-second improvements in their process. And Jennifer Jacubatis came up with a 3-second improvement where we talk about how they reach out to all of you, to the care team out in the field. And we wanted to improve the level of communication. And she had the idea that when she would call that many of you and ask some questions about, survey you on what your needs are. And so she came up with that idea, and we liked it so much that we decided to make it available for everybody. So we launched a team survey, and I will be sending this out to you as well. And basically the team survey is, what should we keep doing? What should we stop doing? What should we start doing? And then finally, how would you rate your level of satisfaction working at Allume? So we're looking for specific things from you. What do you want us to keep doing? What do you like? And what do you wish we would stop? What do you wish we would start? And so everybody who participates will donate $5 to the charity of your choice. We will give you, on the form, there are 3 different choices that you can select. And so we want to encourage everybody to give us your feedback, and we'll take that feedback and start to report it back to you next month, and let you know what we're trying to do to make improvements. And again, just one last thing I'll say about the 3-second improvements is, why we're doing this is because we know that all of you doing what you're doing out in the field or in finance or in fulfillment, everybody who's doing their work, you know best where there is improvements that can be made. And so we want to make sure that you really feel empowered to make those improvements, and more than that, that you communicate them back to us, because we want you to feel recognized for all the many things you already do every day to make the world a better place. And we want to make sure that when you're really cool that could be done somewhere else, we want to have a way to collect those great ideas and share them. So we're going to take all these 3-second improvements and start to go through and see how we pick ones that we feel like can be used throughout. We're going to share them with others, and so that your ideas can become part of Allume's continuous improvement. We do see an innovation as a way to deliver remarkable care, and that we can't deliver remarkable care without continuous improvement. We need to constantly be reflecting upon what the patient's needs are, what our team members' needs are, and how we can adjust accordingly. We're committed to doing our best always, and so that's one of the things about being at Allume is that we really look for people who are committed to being their best, to growing into being their best. And so 3-second improvements are a way for you to do that. And also, I think when you get up in the morning and you feel like, hey, I can make a difference, that's exciting. And that's what we want for you to feel. We want you to feel excited to go to work, empowered to make improvements, make an impact, and we want to hear about it. And for me, that's the big thing, is I want to know all the good stuff that's going on out there. And I want to be able to celebrate you and know what you're thinking and figure out how to make the company better and how to make our service to patients and to you better. And the way that I feel like one way that I can do that is by receiving the 3-second improvement. So again, the idea is for you to fill out the 3-second improvement form as often as you possibly can, whenever you have great ideas for how you can improve what you are doing in the service of whatever your role is, and share it with us. And we'll review them. We'll, this month, to get us kicked off, for the first, up to $50, we'll give you $5 per improvement for your first 10 improvements, essentially. And we'll also enter you into the drawing for $500. So it's kind of a fun way for us to celebrate and to work together to do good in the world. All right, so do you all have any comments or questions from today's topics? Anything on your mind? You think of some ideas that you want to give back to us, tell us about. Hopefully you'll have lots of ideas and feedback for us on your 3-second improvements. And then, the other survey is kind of how you would like to see Allume improve, how you would like to see the leadership team improve, how you would like to see me improve, right? So what do you want us to keep doing? What do you want us to stop doing? What do you want us to start doing? We want to hear you. We want to find ways to meet your needs, and we won't be able to meet every need, right? And that's just part of life, right? It's part of working in a company or with a team. We won't be able to do everything, but it will be helpful for us to know what your wants and needs are, so we can try to improve and together create a place where everybody feels valued, respected, and excited to come to work, and like you can be your very best self. All right, any other comments or questions? All right. Well, I thank you so much for being here today, and I hope you have a wonderful day. It is a sunshiny day. Hopefully you'll get outside for a little bit of it. If nothing else, go drink yourself a cup of tea or a nice glass of cold water and soak up a little sunshine. And no, I'm grateful that you're a part of my life and that you're part of the community and connecting to our patients and families. And I look forward to hearing about all your great ideas. I want to hear your feedback in the survey. And I look forward to being with you again soon.
Thank you, Coco.
Thank you.